revise it. And second thing is, those who are joining now, who are pursuing your second years, of course, this is going to be very important for you, and it is also easy for you to revise, because at this point of time, ANS would have been covered in entire Tamil Nadu. All the colleges would have covered the ANS now. So now this ANS is going to be a revision session for you all. So before moving to that, I just want to tell one thing. Most people would be like thinking by now, most people would have got the advice that failure is a stepping stone for success. Yes, of course, it is a stepping stone for success. But according to me, it is not just a stepping stone for success, but it's a diving board. Why I call it as diving board? Because when you jump over it, you have two options. One is you can propel to height than the first position. That means you can still get more marks than the people who had got more marks in your college right now when they wrote your final year, when they wrote your second year exam. But at the same time, if you are not concentrated at this point of time, if you are not concentrated at this point of time, you can slip away into, and you cannot reach a good position. That is what literally what I feel. So this period is very crucial for you. You are going to study your third year along with the second year topic. So you are going to get a dual stress to read your third year exam for your internals and other thing, and second year for your supply exam. So this journey, we will travel with you all together so that you can get a good score. Until you reach that good score, we will be there to guide you all. So as I told that, as we know that there are no dead ends in the life, only we have the dead end thinking. So what we can do is, நம்ம லைஃப்ல வந்து எந்த டைரக்ஷன்ல போகணும் அப்படிங்கறத now we will decide and we will work on it. Okay, so with that, how to start with today? We all know that there are major 3 subjects. For few people there will be 3 subjects, and few of them there won't be 3 subjects and all. So only one subject may be there for you all as a supply, and you're going to write. But these 3 are the major subject. I could see that majority of them had pathology as a problem, and pharmacology was also a problem for some people. In pharmacology, we will start today. Okay, so if you see in pharmacology, you're going to have just basically 12 parts. Okay, so first one is going to be a general pharmacology, ANS, PNS, CVS, RS, renal, autocoid, blood, GIT, chemotherapy, which will be including both your antimicrobials as well as your anti-cancer drugs, and hormones, toxicology. That means that these 12 parts can be covered in 30 days very easy. Okay, so today what we are going to see is, we are going to see this just cholinergic and anticholinergic as the topic. So till now, if you have any suggestion or anything to tell, you can just put in the chat box. Or if not, if you want me to continue with the autonomic nervous system, then I will start with. Good. So before starting with, I'll just tell you that I'm going to use just 2 books, because now there are 2 perspectives. One is concept based, you have to learn. Of course, that is necessary. Second thing is how to write in your exam. So these sessions will be focusing on both the aspects. So concept wise, my notes will be, and I will also tell you at what points, which are the topics which need to be concerned more in conceptual, and exam ku eppadi eludhanum. Idu rendume nama paaka porom. So for exam oriented, if you're going to see, I'll suggest you 2 books. Okay, so what are the 2 books is, one is Padmaja. So Padmaja Uday Kumar, and the book வந்து பாத்தீங்கன்னா, she is a JIPMER faculty. So அவங்க book will be like somewhat or standardized இருக்கும், at the same time exam க்கு ஈஸியா எழுத முடியும். Second thing is going to be, as you all know, you all would have read already, Tara Schemberg. But Tara Schemberg oda problem enna, everything is very small. Maybe now at this point of time you would have felt that Tara Schemberg la படிச்சதனால maybe நமக்கு மார்க் கம்மியா இருக்கா அப்படிங்கிறது நம்ம யோசிப்போம். So we will just make sure that Tara Schemberg, Padmaja Uday Kumar, in the rendu book smootha படிச்சீங்கன்னா, it will be easy for you to score in your exam. Okay, இப்போ உட்காந்து ட்ரிபாத்தி உட்காந்து படிக்கிறது கஷ்டம் for exam wise. But நான் இப்ப சொல்லி தரும்போது பிளஸ் என்னோட நோட்ஸ் வந்து பாத்தீங்கன்னா, it will be like both. Okay, so என்னோட இது வந்து பாத்தீங்கன்னா both it will be, so that we will see. Video not coming, no problem. Anyway, my audio is, you can able to hear my audio, right? That won't be an issue, right? Anyone? Is my audio clear? Or do you have any issue with my audio? Someone, can you please put in the chat box if my audio is clear? Right. Okay. So I will be just to have a stable internet connection. I'm just switching off my video. So that is why you couldn't be able to view it. So let me start with, okay, cholinergic drugs. So if you have Tarashambag with you, you can just take the Tarashambag with you and you can keep it, because from Tarashambag, if I'm just trailing any points extra, you can write it just near to the Tarashambag, you can write so that you will be able to revise easily. Okay. So cholinergic drugs. இது போறதுக்கு முன்னாடி first remember, so உங்களோட total nervous system, உங்க பாடியில இருக்க nervous system, we are going to classify into two. ஒன்னு central nervous system, இன்னொன்னு வந்து peripheral nervous system. இந்த peripheral nervous system தான் further we are doing into somatic and autonomic nervous system. ஒன்னு somatic, இன்னொன்னு autonomic nervous system. இப்போ இந்த autonomic nervous system அப்படின்னு நம்ம எடுத்தோம்னா again that is going to be divided into two. ஒன்னு sympathetic nervous system, இன்னொன்னு parasympathetic nervous system. இதுதான் ஃபர்ஸ்ட் பேசிக். ஓகேவா? சிம்பத்தட்டிக் பாராசிம்பத்தட்டிக் ரெண்டா நம்ம பிரிக்கிறோம். ஓகே. சோ இப்ப சிம்பத்தட்டிக் பாராசிம்பத்தட்டிக் இந்த மாதிரி நம்ம பிரிக்கிறோம்ல, இது வந்து பாத்தீங்கன்னா மேஜரா எதெல்லாம் ஆக்ட் பண்ணுது அப்படின்னு நம்ம பார்த்தோம்னா, so these two are called as autonomic nervous system. They are going to act on the vital organs. Vital organs na enna? Heart, kidney, uterus, gastrointestinal tract, eye, glands, blood vessels. இதெல்லாம் வந்து பாத்தீங்கன்னா one of the major vital organs in our body. அந்த vital organsல தான் இது ஆக்ட் பண்ண போகுது. இந்த vital organs are necessary to maintain the state of equilibrium in our body. அதனால தான் நம்ம autonomic nervous system is very important, and the drugs which you are giving in an autonomic nervous system is very important. ஓகேவா? So coming to the today's session, cholinergic, anticholinergic. இதுல இருந்து நம்ம கேட்கக்கூடிய essay வந்து பாத்தீங்கன்னா 3 essay இது வரைக்கும் கேட்டிருக்காங்க. What are the 3 essays they have asked? ஒன்னு OP poisoning, Organophosphorus poisoning. அது related ஆன questions they have asked in your exam. Second thing அப்படி நம்ம பார்த்தோம்னா, so நமக்கு வந்து பாத்தீங்கன்னா Anticholinestrase. Anticholinestrase. இது வந்து பாத்தீங்கன்னா they have asked in your exam as a essay question. And third question is going to be your anticholinergic. Anticholinergics na main வந்து பாத்தீங்கன்னா your atropine. இந்த 3 விஷயத்தை மட்டும்தான் you are going to focus today. Remaining things is for concept. So that's what I told you. இந்த 3 essay question எப்படி எழுதணும் நமக்கு தெரியணும் at the end of the day. Apart from it, you need to remember how to conceptually remember your topics. Clear? Okay. Now coming to the cholinergic agents. So what is this cholinergic agents? Cholinergic agents அப்படின்னா which is going to implement the action of your parasympathetic nervous system. So எது உங்களுக்கு parasympathetic nervous systemல வந்து which is going to help, okay, அப்படி நம்ம பார்த்தோம்னா your acetylcholine. இந்த acetylcholine is a major neurotransmitter. ஓகேவா? சோ இது வந்து neurotransmitter ஆக்ட் பண்றப்ப இது என்னெல்லாம் வேலை பார்க்குதுன்னா, it's nothing but it's a ester of choline. So ஓகேவா? It's a ester of choline. So this is how it is going to act. So first what happens is you are going to have a mitochondria. இந்த mitochondria என்ன பண்ணுது? Acetyl S-CoA is going to convert it into CoA, and இந்த acetyl வந்து வெளில வந்துருது. இந்த acetyl வந்து என்ன பண்ணுதுன்னா, it is going to join with the choline. Acetyl-CoAவும் choline-உம் join ஆகுது. So this is your choline, this is your acetyl-CoA, acetyl S-CoA. இவங்க ரெண்டு பேரும் சேர்ந்து they are going to form a acetylcholine. ஓகேவா? so இந்த acetylcholine அப்படிங்கிறது it is going to be packed into the synaptic vesicles in your presympathetic neuron. From your presympathetic neuron, what happens? Along your synaptic cleft, it is going to enter out. Along the synaptic cleft, it is going to come out, and on the acetyl-CoA receptor, which is going to be presented in the post-synaptic neuron, which is going to be present in the post-synaptic neuron, அங்க போய் இது என்ன பண்ணுது? It is going to sit, and all those actions are going to be taken place. So once acetyl-CoA அங்க உட்கார்ந்தோன்னே என்ன ஆகும்னா, இந்த acetyl-CoAல இருக்கக்கூடிய choline acetic acid அப்படின்ட்டு என்ன பண்ணும்? ரெண்டா பிரியும். எப்ப? இந்த action of acetylcholine esterase. So இந்த ரெண்டு ஸ்டெப் தான் ரொம்ப இம்பார்ட்டன்ட். So இப்ப என்ன பண்ணுது? இந்த acetylcholine esterase என்ன பண்ணும்னா, ரிமைனிங் இருக்கக்கூடிய acetylcholine, apart from the functioning, when there is going to be excess of acetylcholine, it is going to destroy it, and it is going to form choline and acetic acid. And the choline reabsorb பண்ணிக்கும். Reabsorb பண்ணி என்ன பண்ணுது? Again it is going to be going as a cycle. அப்ப இந்த acetylcholine esterase, when it is inhibited, when you are going to inhibit this acetylcholine esterase, what happens? There is going to be a more action of acetylcholine acetylcholine on the synaptic cleft on the acetylcholine receptor, which is going to increase the acetylcholine action at particular organ. Okay, that's all. So by enzyme choline esterase, what happens? It is going to be metabolized. Now you have to remember one important thing. What is the two types of choline esterase? One true choline esterase, இன்னொன்னு pseudo choline esterase. Okay, what is this true choline esterase is going to do? True choline esterase அப்படிங்கிறது, it is going to act on the ganglion, it is going to act on the neuron, it is going to act on the neuromuscular junctions. அதாவது anything pertaining to your nervous system. Okay, anything pertaining to your nervous system, it is going to act. அதே pseudocholine esterase அப்படிங்கிறது, it is going to be acting in the plasma, liver and other organs. Okay, if hydroxylases is going to be present, okay, this is going to convert into several esters in addition to that of your acetylcholine. So that is your pseudocholine esterase. அது என்ன பண்ணுதுன்னா, just not it is going to act on your acetylcholine, it is going to act on any esters. So it's nothing but your ester. அந்த எஸ்டரை இனிபிட் பண்ணது, பிரேக் டவுன் பண்ணது. அது எந்த எஸ்டர்ஸ் இருந்தாலுமே ஒரு ஆர்கன்ல, apart from this acetylcholine, there are lots of other ester. What is ester? ஒரு acid, ஒரு base join ஆகிறது. So we would have read it earlier. So அதை break down பண்ணும் இது. ஓகேவா? I think you clear with this. So இந்த acetylcholine எப்படி break down பண்ணுது? Choline plus acetic acid அப்படின்ட்டு it is going to break down. Okay. Now இது ரெண்டும் இருக்குல்ல. One is your acetylcholine esterase. Second thing is a butyrylcholine esterase. This butyrylcholine esterase is the pseudoester. In the butyrylcholine ester, it's nothing but a pseudoester. So this acetylcholine is going to be present in all cholinergic site. Butyrylcholine esterase is going to be present in the plasma, liver, intestine. So hydrolysis is going to be occurring very fast. Here it's going to be occurring very slow. Inhibition more sensitive to the physostigmine. Physostigmine na anticholine esterase. And the anticholine esterase or inhibition faster argo. Ade inge organophosphates da faster act panno. Function is termination of acetylcholine action. Inge hydrolysis of ingested ester. Okay, now coming to your parasympathetic system. Okay, remember any parasympathetic system, it is going to have action at several places of your nervous system. If you go and take your Tarashambak at this point of time, okay, Tarashambak, I don't know the new page number because I am having the old book of Tarashambak. So Tarashambak la cholinergic system before cholinergic system அந்த ஆர்கன்ஸ் எல்லாவோட பிக்சர் போட்டு பாராசிம்பத்தட்டிக் ஸ்டிமுலேஷன்ஸ்னால ஏற்படக்கூடிய ப்ராப்ளம்ஸ் கொடுத்துருப்போம். ஸோ அந்த இது பாத்தீங்கன்னா இட் இஸ் வெரி யூஸ்ஃபுல் ஃபார் யூ டு ஈஸி ரிமெம்பரன்ஸ் வித் தட் பிக்சர்ஸ். ஓகேவா? ஐல என்ன பண்ணும்? ஐல இட் இஸ் கோயிங் டு காஸ் மியோசிஸ் ஆர் கன்ஸ்ட்ரிக்ஷன் ஆஃப் யோர் பியூப்பிள். லங்ஸ்ல வாட் இட் இஸ் கோயிங் டு டூ? இட் இஸ் கோயிங் டு டூ bronchospasm. ஹார்ட்ல என்ன பண்ணும்? இட் இஸ் கோயிங் டு டிக்ரீஸ் யுவர் ஹார்ட் ரேட். இட் இஸ் கோயிங் டு டிக்ரீஸ் த ஃபோர்ஸ் ஆஃப் கான்ட்ராக்ஷன். whereas in GIT it is going to increase the peristalsis and secretion. So அதனாலதான் we call this as a ஒரு உட்கார்ந்து சாப்பிட்டுட்டு இருக்கிறப்ப, okay, just imagine you are going to take rest, you are going to eat food. At that point of time, what all the actions that your body does, that is called as your parasympathetic system. So you are not, at this point of time, you don't need to be alert. You wanted to eat food. You wanted to you're at the resting point. So you can empty your bladder. Okay, so that's what happens. There will be a contraction. So you are going to eat food. Therefore, salivary secretions will be increased. So if you are going to sit relaxed, so your heart rate will be decreased. Your blood vessels will be dilated. And all these things are going to be the parasympathetic action. I guess I'm making it very clear. Okay, so now coming to the cholinergic receptors. So muscarinic receptors or subtypes என்னென்ன அப்படின்னு நம்ம பார்க்கிறோம். ஓகேவா? So ஒரு muscarinic receptors அப்படின்னு எடுத்தீங்கன்னா, so what are the receptors which are present? So one பாத்தீங்கன்னா, you are going to first divide it into ஒன்னு நியூரான்ஸ் லாக் பண்ணும், இன்னொன்னு நியூரோமஸ்குலர் ஜங்ஷன்ஸ் லாக் பண்ணும். வாட் இஸ் நியூரான்ஸ்? ஒரு நர்வ்ல இருந்து இன்னொரு நர்வ்க்கு ஆக்ட் பண்ணும். So that is your neuron. ஒரு நர்வ்ல இருந்து இன்னொரு நர்வ்க்கு ஆக்ட் பண்ணும். that is your neuron. அதே ஒரு நர்வ்ல இருந்து மசிலுக்கு போற இடம், that is neuromuscular junction. So I think you are clear now. Okay. So, total cholinergic receptors are divided into two things. One muscarinic receptors, another nicotinic receptors. So, what are the two things? One is your muscarinic receptor, other thing is going to be nicotinic receptors. So, first one is going to be your muscarinic receptors. Okay. So, 1 minute. Okay. So, first is going to be your muscarinic receptors, nicotinic receptors. In muscarinic receptors, you are going to have M1, M2, M3, M4, M5. So these are the muscarinic receptors. Nicotinic receptors, you are going to have only two. One neurons lack panno, இன்னொன்னு neuromuscular junctions lack panno. That is why you call it as a NM and NN. So that is why you call it as a NM and NN. With up to this, is it clear for you? Up to this, is it clear for you? Can I just move forward? Okay. So இப்ப மஸ்குரானிக் நிக்கோட்டினிக் அப்படின்னு நான் ரெண்டா பிரிக்கிறேன்ல, இதுல மஸ்குரானிக் அப்படிங்கிறது இட்ஸ் a G protein coupled receptor. So all your muscarinic is going to be G protein coupled receptors. G protein coupled receptors. All your nicotinic are going to be ion gated receptors. Each and every point is important. Why I just tell this? Okay, va? So one G protein coupled receptors, இன்னொன்னு ion gated channels. Okay, va? All receptors of acetylcholine are going to be stimulatory except எது? Next question. So எல்லாமே வந்து stimulatory action தான் பண்ணும் except எது அப்படின்னு பார்த்தோம்னா M2 and M4. M2 and M4 மட்டும் it is going to be a inhibitory. M2 and M4 are going to be inhibitory. ஓகேவா? M2 M4 இவங்க ரெண்டு பேருமே inhibitory mechanism, மீதி எல்லாமே வந்து stimulatory mechanism. ஓகேவா? அதே நீங்க nicotinic receptors எடுத்தீங்கன்னா ஓகே N, ஓகேவா? nicotinic N for N அப்படின்னு வச்சுக்கோங்க. ஓகேவா? nicotinic receptors அப்படின்னு எடுத்தோம்னா so இது வந்து நியூக்ளியஸை இன்வால்வ் பண்ண போகுது. So this is going to be involving your nucleus. So nerve junctions or nerve muscle junction. ஓகேவா? So இதுதான் உங்களுக்கு தெரியணும். ஓகே, M1 to M5 இதுல வந்து M1 M3 M5 இது மூணுமே IP3DAG ல ஆக்ட் பண்ணுது. IP3DAG இந்த பாயிண்ட்மே ரொம்ப இம்பார்ட்டன்ட். So IP3DAG is a stimulatory neurotransmitter. அப்ப stimulatory neurotransmission மூலமா your M1 M3 M5 is going to act. M1 M3 M5 வந்து IP3DAG channel வந்து if it is going to be stimulating, what happens? There is going to be increase in the calcium ion, calcium channel open ஆகும். So whenever there is a calcium channel opening, what happens? There is a contraction of muscles. What happens? There is a contraction of muscle. So ஓகேவா? அப்ப இது எங்க present ஆயிருக்கணும்? They are present on the surface of the smooth muscles. So they are present on the surface of the smooth muscle. So your calcium is a tertiary messenger. Your calcium is a tertiary messenger. Now the question arises, எந்தெந்த M1 M2 M3 M4 M5 அது மாதிரி நம்ம வச்சிருக்கோம்ல, இது எல்லாம் எங்கெங்க இருக்கு அப்படின்னு நம்ம பார்த்தோம்னா M1 they are going to be present in the autonomic ganglia, it is going to be present in the gastric glands, it is going to be present in the CNS. Your M3 is going to be present in the glands, smooth muscles, eyes. And then M5 central nervous system. Always remember M4 M5 are central nervous system. அதுல M4 is a inhibitory, M5 is a stimulatory. இப்ப நான் சொல்றதெல்லாம் நீங்க you can take it as a notes easily. ஓகேவா? சோ மஸ்குரைன் அப்படிங்கிறது என்னது? இட்ஸ் அகோனிஸ்ட். சோ அசிட்டைல்கோலைனோட அகோனிஸ்ட். அப்ப இதுக்கு ஆன்டகோனிஸ்டா யார் ஆக்ட் பண்ணுவாங்க? ஆன்டிகோலைன் ஆர் ஆன்டி மஸ்குரானிக். வாட் இஸ் ஆன்டி மஸ்குரானிக்? இட் இஸ் யுவர் அட்ரோபின். சோ ஈஸியா சொல்லணும்னா எக்ஸஸ் ஆஃப் மஸ்குரானிக் ட்ரக்ஸ் நீங்க கொடுக்கறப்ப ஆன்டி மஸ்குரானிக் should act. That is your atropine will be acting. That is what organophosphorus poisoning, which is a essay question for you. So let us go to it. So before going, so your direct acting parasympathomimetic drugs இது என்ன பண்ணும்? டைரக்டா ஆக்ட் பண்ணும். அப்படி இல்லனா இன்டைரக்டா எப்படி ஆக்ட் பண்ணுது? all your parasympathomimetic drugs ஒன்னு it is going to be directly sitting on the receptor and stimulate the parasympathetic system, or it is going to break down your acetylcholine esterase so that your acetylcholine is going to be made more available to act on the receptors. Okay, finally we are moving into the cholinergic drugs. இதுல ஏதாவது டவுட் இருக்கா? If you are not having any doubt at this point of time, I will move towards the cholinergic drugs. Just 1 minute for you all to ask any doubts in the chat box. Good. So if everything is clear, I hope. Next, we will move towards the cholinergic drugs. Okay. So cholinergic drugs is otherwise called as cholinomimetic or parasympathomimetic. Okay. Rendu name irukadhu. Okay. So cholinergic drugs, they are producing going to be a similar action to that of the acetylcholine. As I told you, they are going to directly act on the receptors, activate them to produce the effect, or they are going to indirectly act. How? By inhibiting the enzyme cholinestrase, thereby preventing the hydrolysis of acetylcholine. Because of that, what happens? There is an excess availability of acetylcholine to act upon the receptors and produce parasympathomimetic action. Cholinergic agents வந்து acetylcholine தான் is a main compound. In the compound என்ன பண்ணும்னா, problem is they are going to be rapidly hydrolyzed by the cholinestrase. அப்ப நீங்க acetylcholine டைரக்டா கொடுக்கறப்ப it has no therapeutic application. ஓகேவா? So அதனால what we are doing is we found out cholinergic agonist. So what are the other cholinergic agonists that we found? So that you can divide it into cholinergic agonists can be divided into choline esters and alkaloids. Choline esters. What are the choline esters? You know, ஒன்னு வந்து மெத்தில் ஒன்னு வந்து acetylcholine, இன்னொன்னு மெத்தகோலைன், கார்போகோல், பெத்தனகோல். Okay, so in the names தான் one of the irritating and it's going to be confusing you all. So ஒண்ணுமே இல்ல, ஒரு group of drugs ஓட action நான் வச்சுக்கோங்க always. Okay, then what you can do is இந்த எல்லாத்துலயுமே பாருங்க, either it's going to be choline or it is going to be chol. Okay, anything that ends with this is going to be your choline esters. So அந்த மாதிரி நம்ம நான் வச்சுக்கலாம், it is easy, right? So anything you can remember it like choline esters. I think in the video it is directly taken from your tripathi only. Clear? Okay. So இதான் உங்களோட choline esters. So then what happened? There is some improvement. அப்ப alkaloids கண்டுபிடிச்சாங்க. So there is some issue with choline esters that we will be discussing. அதுல இருந்து நமக்கு வந்து to improve the drug effect, they found this alkaloids: muscarine, pilocarpine, aricoline. Okay va? இது மூணு alkaloids. These are the cholinergic agonists, that is directly acting on the cholinergic receptors. Okay, then what happens? Indirectly acting, அதுதான் anticholinestrase. Anticholinestrase என்ன பண்ணும்? They are going to destroy your cholinestrase. So cholinestrase destroy பண்றது ரெண்டு விதம், ஒன்னு reversible, இன்னொன்னு irreversible. ஓகேவா? reversible you can divide into two: carbamates, acridin. கார்பமேட்ஸ்ல வந்து பைசோஸ்டிக்மைன். இப்ப பாருங்க, கார்பமேட்ஸ்ல நீங்க நான் வச்சுக்க வேண்டியது வந்து எல்லாமே ஸ்டிக்மைன்ல முடியும். நியோஸ்டிக்மைன், பைசோஸ்டிக்மைன், பைரிடோஸ்டிக்மைன், எட்ரோஃபோனியம். ஓகே, எட்ரோஃபோனியம் மட்டும்தான் உங்களுக்கு டிஃபரெண்ட் ஆகும். ரைவாஸ்டிக்மைனும் இட் இஸ் கோயிங் டு பி ஆன் த ஸ்டிக்மைன். அப்ப 4 ட்ரக் ஸ்டிக்மைன் நான் வச்சுக்கலாம்: பைசோஸ்டிக்மைன், நியோஸ்டிக்மைன், பைரிடோஸ்டிக்மைன், ரைவாஸ்டிக்மைன். அதுக்கப்புறம் இருக்கிறது என்ன? ஜஸ்ட் யோர் எட்ரோஃபோனியம், donepezil and your galantamine. அதுல எட்ரோஃபோனியம் மட்டும் நான் வச்சுக்கோங்க. donepezil, galantamine தனியா படிக்க வேணாம். We will remember just one line about each drug so that you can write all the actions எல்லாமே சேமா இருக்கும் எல்லா ட்ரக்குக்கும் except that one clinging point that we will see. acridin வந்து பாத்தீங்கன்னா ஒரே ட்ரக் தான், டாக்ரின். அதுக்கப்புறம் தான் irreversible. ஸோ அங்கதான் நமக்கு இஷ்யூ ஆகுது. என்ன? கார்பமேட்ஸ், ஆர்கனோபாஸ்பேட்ஸ். கார்பமேட்ஸ் அப்படிங்கிறது கார்பாரில் அண்ட் propoxur. ஓகேவா? சோ அப்புறம் organophosphates. Organophosphates are nothing but they are used as an insecticide, they are used as a ferticide, okay, அதெல்லாம் fertilizers, அது எல்லாமே வந்து chemical welfare they are using. அப்ப அதுல என்னது? டைஃப்ளாஸ், எக்கோதியோஃபேட், malathion, diazinion. So இது எல்லாமே we are going to use it. Okay va? Okay, done. Now coming to the classifications. Now I think almost நம்ம பார்த்தோம். So parathion, malathion, nerve gas, இது எல்லாமே வந்து OP compounds. Organophosphorus தான் உங்களுக்கு மெயினா கேக்குற question. அப்புறம் ஏன் why you should see the others also. நான் organophosphorus டைரக்டா எடுத்துடலாம். நெக்ஸ்ட் கொஸ்டின் அதான் இருக்கும் உங்களுக்கு. ஈஸியா ரிவிஷன் பண்ணனும், organophosphorus மட்டும் படிச்சுட்டு போயிடலாம். But what happens is when you know the action of acetylcholine, okay, organophosphorus compounds என்ன பண்ணும்? It is going to destroy the acetylcholine. அப்ப acetylcholine ஓட esterase destroy பண்ணும்போது acetylcholine ஓட action அதிகமா இருக்கும். அப்ப if you wanted to know the effects of your all your anticholinestrase, you have to remember acetylcholine action. அப்ப எக்ஸசிவா அசிடைல்கோலின் ஆக்ட் ஆனா என்னென்ன பண்ணுங்கிறது நமக்கு தெரிஞ்சதுன்னா it will be easy. So that is the reason why I am also talking about this. ஓகேவா? Now coming to the action of acetylcholine. அசிடைல்கோலினோட ஆக்ஷன்ஸ் வந்து பாத்தீங்கன்னா ஒன்னு மஸ்குரானிக்கா ஆக்ட் பண்ணும் இல்ல நிக்கோட்டினிக்கா ஆக்ட் பண்ணும். ரெண்டா நம்ம ஃபர்ஸ்டே பிரிச்சோம். இப்ப மஸ்குரானிக்ல it is going to act on the CVS. இப்போ ஒரு சிஸ்டமா போவோம். CVS எங்க நான் சொன்னேன் M2 receptors. அதுதான் வந்து heart, nerves, smooth muscles அதுக்கு சப்ளை பண்ணுது. M1 எதுக்கு சப்ளை பண்ணுது? anyone? So as I already told you, where is the M1? M1 எங்கெங்கெல்லாம் இருக்கு? என்ன ஆக்ஷன் M1 எந்தெந்த ஆர்கன்ல இருக்கு? Someone in the chat box? I think I have told you this in the starting itself. M1, M2, M3, M4, you have M5. What is the organs where your M1 is present? M1 is present in the autonomic ganglia. In your autonomic ganglia, it is going to present in the autonomic ganglia. M2 is present, CNS M1 present ஆகும். M2 வந்து it is present in the cardiac muscles and your smooth muscles. M3 எங்க present ஆகும்? It is going to be present in the glands. It is going to be present in the smooth muscles. It is going to be present in your eyes. So glands, smooth muscles, it is going to be present in your eye. And M4 எங்க present ஆகும்? M4 inhibitory action in your CNS. M5 is going to be a stimulatory action in your CNS. Again I'm telling, M2 la தான் cardiac muscle இருக்கு. அப்ப cardiac muscle ல how your acetylcholine is going to act? Acetylcholine is going to inhibit. Acetylcholine is going to inhibit. So that is why you're going to have a decreased heart rate, decreased force of contraction, decreased conduction, etc. இது வரைக்கும் clear-ஆ? Okay, now coming to your blood vessels. Again I told you, smooth muscles அப்படின்னா மோஸ்டா வந்து பாத்தீங்கன்னா blood vessels அது வந்து smooth muscles இருக்கு. So blood vesselsல என்ன பண்ணும்? It is going to act through M3 receptors or it is going to act through M2 receptors. Someone, so உங்களோட as per my இதுல போட்டிருக்கபடி, okay, what happens is it is going to be acting through the M3 receptors போட்டிருக்கேன். M3 என்ன பண்ணும் யூசுவலா? M3 is going to stimulate. ஓகேவா? M3 ஓட ஆக்ஷன் என்னது? It is going to be stimulate ன்னு தான் நான் சொன்னேன். So which are the thing which is going to cause inhibition? Which are the thing which is going to cause stimulation? Again someone? M4, M5, they are going to be causing the inhibitory. மீதி எல்லாமே வந்து பாத்தீங்கன்னா stimulatory function அப்படின்னு நம்ம சொல்றோம். Smooth muscles, ஓகேவா? So M3 வந்து M3 receptors வந்து it is going to present in the blood vessel. So what happens is they are going to cause decrease. How? By causing vasodilatation of blood vessels. அப்ப நீங்க கேட்கலாம், M3 receptors could cause stimulation. அப்ப வந்து vasoconstriction தானே நடக்கணும், ஏன் dilatation நடக்குதுன்னு? இங்க என்ன பண்ணுதுன்னா, they are going to be causing your endothelium to release EDRF. EDRF is a nitric oxide, that is endothelium dependent relaxing factors. And the endothelium dependent relaxing factors release ஆகுது. So that is a stimulation தானே, to stimulate, to increase the endothelium dependent relaxing factors. And the stimulation நால என்ன ஆகுதுன்னா, that in turn causes vasodilatation of blood vessel, and that is going to cause decrease in the BP. So இப்ப clear உங்களுக்கு why you all will think blood vessel la stimulation நடக்குதுன்னா blood vessel should contract. Why it is dilating? It is dilating because of this EDRF stimulation. Clear? Okay, next one, the third action on the smooth muscles. Okay, your acetylcholine is going to increase the tone of all the smooth muscles. It is going to increase the tone of all the smooth muscle except your non-vessels. So vessels tavara meedi ella edathileyume what happens? Their tone is going to be increased. GIT la your tone is increased, peristalsis is increased, all your sphincters are relaxed, therefore it enables you to eat. It is going to enable you to eat. Clear? Then you have this urinary bladder. That you have this detrusor muscle. Your detrusor muscle is going to contract. So if it is going to promote the urine voiding. So if relax நீங்க எந்த வர்க்கும் பண்ணல, it is not an emergency situation, so that you can void your urine at this point of time. ஒரு பிரேக்ல தான் நம்ம போய் void பண்ண முடியும் urine. That is how your body is also functioning. Clear? Then you have this respiratory system. So what happens in respiratory system? It is going to constrict your bronchial smooth muscles. So essentially இருக்கிற எல்லா organs it is going to affect. So heart it is going to decrease. your heart rate, force of contraction. Similarly, your bronchial smooth muscles constriction pannu, therefore it causes bronchospasm. And then most importantly, this is going to increase your secretions. Entire body la secretions increase pannudhu. So it enhances the secretion of all the glands, salivary, lacrimal, nasopharyngeal, gastric, intestinal, ella edathiliyume secretions increase pannudhu. Aduthathu eye la enna agudhu? There's a contraction of circular smooth muscles of your iris. Therefore what happens? It is going to cause contraction of your ciliary muscle. It is going to cause spasm. It is going to cause meiosis. So that is why I told you, the receptor. Do you anyone remember? Can you put in the chat box? What is a receptor that is present in the eyes? What is a receptor that is present in the eyes? Anyone in chat box? Exactly. M3 receptor. What is a M3 receptor? M3 receptor is a stimulatory. What is the inhibitory? Inhibitory is just your M2 and your M4. Clear? I think now you can just relate it. So what happens is, it is going to facilitate your outflow. So when there is going to be a spasm, it is going to secrete, it is going to help in the easier outflow. Outflow intraocular tension will be decreased. Okay, so I think muscarinic receptors function is over. Next, nicotinic action. Nicotinic action, I told you, it is going to act only at the two places, nerve or nerve muscle. So autonomic ganglia is a nerve. So it stimulates your sympathetic and parasympathetic ganglion. So direct parasympathetic action is going to stimulate your sympathetic action also. Then your skeletal muscle, that is going to be a neuromuscular junction. Okay, it is going to cause contraction of your skeletal muscle. Neuromuscular junction, it is going to cause contraction of skeletal muscle. Large doses is going to cause persistent depolarization of your skeletal muscle that results in the paralysis. Then you have this CNS. What is going to be the effect in CNS? So acetylcholine is a neurotransmitter at several sites of your CNS. When acetylcholine injected IV cannot cross your blood-brain barrier. Therefore, it does not have any central effects. Okay, though acetylcholine acts as a neurotransmitter at several sites of CNS, acetylcholine cannot be penetrating your BBB, that is your blood-brain barrier. Therefore, it does not have any central effects. Okay, so now that you know acetylcholine very well. Okay, but do you remember, apart from acetylcholine, you told two important things. Methacholine, carbachol, bethanechol. So ellame call la mudiyra drugs irukilla. Appa ஏன் நம்ம புதுசா ஒண்ண கண்டுபிடிச்சோம் அப்படிங்கிறது next question. இது வரைக்கும் நம்ம பார்த்தது acetylcholine, but acetylcholineல it is not crossing your blood brain barrier nu sonneenga. So adukuriya sila problem irukku. Okay, it is going to be easily hydrolyzed. Therefore, you cannot give acetylcholine as a IV. Appa நம்ம என்ன பண்ணனும்? We are going to identify newer group of drugs to overcome the problem. That is where your bethanechol, carbachol came. So choline esters நம்ம என்ன பண்ணோம்னா, we are going to give it in, we are going to combine with the carbonic acid. So you're going to combine with carbamic acid. Okay, this is going to be causing a resistance to the hydrolysis by choline esterase. Therefore, they have a longer duration of action. Up on the point நம்ம overcome பண்ணிட்டோம். Now coming to the clinical cues. So methacholine PSVT. So methacholine oda idu enga nama use pandrom? Methacholine is used in the PSVT. What is PSVT? Anyone in the chat box can tell what is PSVT? I can give you a clue. T stands for tachycardia. VT stands for ventricular tachycardia. Someone? I think someone can tell this. PSVT. What is the full form of PSVT? Exactly. Paroxysomal supraventricular tachycardia. Ariraja and Sugandhan, you are right. So it's a paroxysomal supraventricular tachycardia. This is a very important thing. So Dio PSVT PSVT tachycardia the heart rate is increased. அப்ப நீங்க மெத்தகோலின் கொடுத்தீங்கன்னா என்ன ஆகும்? Heart rate கம்மி பண்ண முடியும். So that is exactly the use of methacholine. Okay, then comes your bethanacol. Bethanacol oda action என்ன? Bethanacol it is used in many important points. எங்கெங்கன்னா 1 2 okay, எங்கன்னா hypotonia of bladder இருந்ததுனா, so எங்கெங்கெல்லாம் you can give bethanacol அப்படினு பார்த்தோம்னா hypotonia of bladder, hypotonia of bladder. அப்ப என்ன பண்ணலாம்? It is going to cause increase in the tone of your bladder. Next one, hypotonia in your GIT. Hypotonia in your GIT. அப்ப என்ன பண்ணும்? This is going to cause increase in the peristalsis. It's going to cause increase in the peristalsis. Okay, example is going to be your congenital megacolon. Third one on this, some case of your post-operative or postpartum urinary retention or paralytic ileus. இங்க எல்லா இடத்துலயுமே நம்ம கொடுப்போம். Xerostomia we can give it as an alternative to your pilocarpine, but pilocarpine is the one which is mostly given. Okay, so carbachol it is used in the open angle glaucoma, meiosis during your ophthalmic surgery. Open angle glaucoma chronica irundha carbachol கொடுத்தோம்னா meiosis ஆகும். So அதனால பாத்தீங்கன்னா it is useful. So அதுக்காக we are going to give. Okay, clear up to this? Any doubts? Okay, I can assume it as you don't have any doubt. And now what are the side effects? Okay, so side effects I haven't mentioned in my slide. Can anyone tell what will be the side effects exactly opposite to that of the uses? இப்ப எக்ஸசிவா உங்களுக்கு பாத்தீங்கன்னா உங்களுடைய பவல் ஹாபிட்ஸ், பவலோட ஸ்டிமுலேஷன், பெரிஸ்டால்சிஸ் இஸ் இன்க்ரீசிங். அப்ப பெரிஸ்டால்சிஸ் இன்க்ரீஸ் ஆகும்போது ஆட்டோமேட்டிக்கா என்ன ஆகும்னா there can be a diarrhea, there can be flushing, there can be excessive salivation, there can be sweating, there can be bradycardia, hypotension, syncope, bronchospasm. அப்ப நீங்க யூசஸையும் உங்களுக்கு தெரியும், அதோட சைடு எஃபெக்ட்ஸும் உங்களுக்கு தெரியும். எப்படி? சிம்பிளா when you understand the concept, when you understand where all it is going to act, you can write your side effects, you can act your uses, everything on your own. இதை நீங்க படிக்கணும்னு அவசியமே இல்லை. நீங்க படிக்க வேண்டியது என்னன்னா where all you are going to give this drug. So what are the action of this mechanism of this drug? அந்த ரெண்டு விஷயமும் நமக்கு தெரிஞ்சதுன்னா we can make it easy. Okay, clear? Okay, next I am going to move towards the cholinomimetic alkaloids. Okay, so why I am talking about the alkaloids? Alkaloids அப்படிங்கிறது பாத்தீங்கன்னா it has a greater affinity than your acetylcholine agonist. Clear? அதுக்காக தான் நம்ம என்ன பண்ணோம்னா alkaloids போனோம். ஆல்கலாய்ட்ல ஃபர்ஸ்ட் நம்ம பார்த்தது பைலோகார்பைன். ஃபர்ஸ்ட் ஓபன் ஆனது என்னன்னா பைலோகார்பைன். இது பைலோகார்பஸ் மைக்ரோஃபைலஸ் அப்படிங்கிற அந்த லீஃப்ல இருந்து வந்தது. இது பாத்தீங்கன்னா லைக் யுவர் acetylcholine, they are going to stimulate your cholinergic receptors. ஆனா what is the difference? Why we are focusing on alkaloids? Because they can cross your blood brain barrier. So ரொம்ப இம்பார்ட்டன்டான பாயிண்ட், they can cross your blood brain barrier. Okay, so that is what you are going to remember. Okay, so its action on eye is another important thing. When you apply it to the eye, it is going to cause meiosis, contraction of your ciliary muscle, spasm of accommodation, and a fall in your intraocular tension. So they are going to be causing fall in the intraocular tension. Every it is going to reduce the, it's going to be increase fall intraocular pressure kammi pannudhu romba easy by what happens? There's going to be meiosis, there's going to be contraction of your ciliary muscle and spasm of accommodation. All these things are going to cause decrease in the intraocular pressure, and that is the reason why you use in the open angle glaucoma, especially chronic open angle glaucoma, acute angle closure glaucoma. Or angle closure glaucoma chronic or more don't use, but when you have a acute angle closure glaucoma, immediately to reduce the intraocular pressure, you are going to give this pilocarpine. But what are the side effects? Okay, yes, of course they also have side effects. Before moving to it, I'll also add that it is going to increase your sweat, it is going to increase your salivary secretion. Increasing your sweat is called as diaphoretic. Increasing sweat is called as diaphoretic, and increase in the salivation is called as sialog. Increase in the salivation is called as see a log. Okay, so pilocarpine is going to lower your BP in therapeutic dose, but it can cause hypertension and tachycardia at a higher doses. Why? Anyone? Why? Yes, because it is going to reduce your heart rate, but you have other mechanisms to act, isn't it? Heart rate decrease pandragana, there are other mechanisms to increase your heart rate. But so what happens? There is other mechanisms that is going to act, that is going to increase the heart rate. So at a longer period of time, at a higher doses, this can also increase your heart rate. Adverse effect. So when you're going to use it as eye drops, what happens is they are going to cause a burning sensation. They are going to cause a painful spasm of accommodation. They are going to cause a brow ache. So eyebrows on the painful arco. Corneal edema sometime varlam. Long term use pandrappa, it can also cause retinal detachment. So following systemic use, salivation, sweating, bradycardia, diarrhea, idallamu varlam. Okay. நான் இந்த பைலோகார்பைன் தனியா ஒரு ஷார்ட் நோட்டா கேட்டிருக்காங்க. சோ இது மட்டும் எழுதுனா போதுமா அப்படின்னு கேட்டீங்கன்னா நோ. So this everyone will be writing. But how you can distinguish yourself and write some extra points, add on the uses in more detail. எப்படி நம்ம டீடைலா கொடுக்க போறோம்னா, yes, you told that glaucoma யூஸ் பண்றோம்ட்டு. ஓகேவா? என்ன drops யூஸ் பண்றோம் glaucoma? If anyone knows, என்ன percentage will be used in glaucoma? Someone? I'll give you just 5 seconds. Okay, so if you don't know, I'll just tell, please note it down. In glaucoma, you will be giving 0.5 to 4% eye drop. You will be giving 0.5 to 4% eye drop will be given pilocarpine. Okay, so pilocarpine Accuset kuda available irukku. Pilocarpine வந்து Accuset என்ன பண்ணுனா, it will be delivering pilocarpine at 20 microgram per hour for 7 days. Okay, so this is an option. Apart from it, pilocarpine is also used as an alternative with midriatic like your omatropin. Why? Because they are going to break down the adhesions between your iris and lens. And you also use it to counter the dryness of mouth that is seen in after a radiation of head and neck due to some tumor if you're going to go a radiation. And you all know that there's a syndrome called as Sjogren's syndrome. So what is that? That is your dryness of mouth and lack of tears. A pilocarpine can be used that is going to solve both these problems. That is going to solve your both these problems. So what are the other alkaloids you know? Okay, நம்ம first ஒரு classification படிச்சோம்ல, அதுல ஒரு alkaloid வந்து pilocarpine. What are the two other alkaloid which we studied? Someone? What are the two other alkaloids? Come on. Hari Raja, Sugandhan, someone? Yeah, aricolin. Dinesh, very good. One is your aricolin. Second thing is going to be your muscarine. Aricolin, muscarine. Okay, so your muscarine is nothing but it's an alkaloid that is present in the species of your mushrooms. Amanita, அப்படிங்கிற mushroom ல இருந்து நம்ம பார்க்கிறோம். இது வந்து responsible for poisoning when mushrooms are consumed. So mushroom poisoning. So எதுக்காக நான் இந்த question கேட்டேனா, so your muscarine is going to cause mushroom poisoning. This can be asked as a short note question. அவன் twist பண்ணனும்னா என்ன பண்ண முடியும்? மிஞ்சி போனா இந்த questions தான் அவன் கேட்க முடியும். வேற questions எங்க இருந்தா அவன் கேட்க முடியாது. அப்ப உங்களுக்கு muscarine என்ன பண்ணுது? Mushroom poisoning cause பண்ணுது. அப்ப மூணு டைப்பா mushroom poisoning நம்ம பிரிக்கலாம். One is early onset, second is a hallucinogen, third is a late onset. Hallucinogen வந்து பார்த்தீங்கன்னா Amanita muscaria அப்படிங்கிற ஸ்பீஷீஸ்ல what it does is it is going to cause என்ன பண்ணும்? Ataxia, delirium, hallucinations. So எதுக்காக ஒருத்த வந்து அந்த மஷ்ரூம்ஸ் எடுத்துக்கிறாங்க? They want to cause a hallucination. அப்ப hallucination, ataxia, delirium. அப்ப ஆல்கஹால் ஒருத்தர் சாப்பிடுறப்ப எப்படி இருக்குமோ அதே மாதிரியே தான். But remember, this is going to be again similar to the symptoms of atropine poisoning. அப்ப atropine poisoning லயும் இது இருக்கறனால நம்ம இந்த symptoms-ஓட ஒருத்தர் வராங்கன்னா நம்ம இவங்களுக்கு atropine கொடுக்க கூடாது. Because this is a cholinergic, anticholinergic கொடுக்கலாம். But in the position நம்ம கொடுக்க மாட்டோம். Why? Because the both is going to be present similarly. அதனால நம்ம கொடுக்க மாட்டோம். So அடுத்தது early onset. Early onset வந்து இந்த you have this inosib, INOCYBE. அந்த ஸ்பீஷீஸ்ல இருந்து வரும். இது 30 to 60 minutes of your mushroom ingestion that is going to cause muscarinic stimulation. So what are the muscarinic action? You know what are the muscarinic action, isn't it? என்னென்ன muscarinic action இருக்கு? Diarrhea, okay, vomiting, bronchospasm, nausea, salivation, abdominal colic, hypotension, bradycardia, இதெல்லாமே என்னது action of your acetylcholine தான். ஸோ அதுதான் நான் சொன்னேன், acetylcholine ஆக்ஷன் தெரிஞ்சா அதோட பாய்சனிங்க்கு எக்ஸசிவா இருக்கிற எல்லாத்தையுமே நீங்க போட்டீங்கன்னா உங்களுக்கு ஆன்சர் வந்துச்சு, அவ்வளவுதான், சிம்பிள். ஒரே லேட் ஆன்செட் எப்போ ஆகும்னா அமானிட்டா ஃபாலாய்ட்ஸ் அப்படிங்கிற அந்த ஸ்பீஷீஸோடது சாப்பிட்டா லேட்டா ஆக்ஷன் வரும். அதுவும் எப்படின்னா லிவரோட செல்ஸை டெத் இட் இஸ் கோயிங் டு கில். அப்ப லிவர் செல்ஸ் டை ஆகிறதுனால தேர் இஸ் கோயிங் டு பி அ டெத். ஓகேவா? இதுக்கு நம்ம என்ன ட்ரக் கொடுக்குறோம்னு பாத்தீங்கன்னா பென்சிலின் கொடுத்தாலே போதும் அப்படின்னு சொல்றாங்க. ஓகே, very clear. So with this we have completed the basics. Pilocarpine is a short note. Now you will be able to write your short note, I guess. இதுல ஒரே ஒரு extra point note பண்ணிக்கோங்க. This is a toppers. Okay, ஒரு point extra. Cevimelin, CVVIMELINE, cevimelin. It is a derivative of your acetylcholine which is going to directly stimulate the muscarinic receptors and they can be used for increasing your salivary secretion in your Sjogren's syndrome. What is the drug called as? That drug called as CEVIMELINE, cevimelin. Okay, va? Idu vandu it's a neat question. Okay, so you don't want to remember, just remember for your concept. Okay, now directly acting cholinergic drugs நம்ம முடிச்சிட்டோம். இப்போ நெக்ஸ்ட் நம்ம பார்க்க போறது anticholinestrase or indirectly acting cholinergic. So அதுல first one என்னது? Your anticholinestrase. So you call it as anticholinestrase, you call it as a cholinesterase inhibitor, whatever name which is going to be helpful for you to remember. Okay va? But in the acetylcholinesterase என்ன பண்ணுனா they are going to cause the hydrolysis of your acetylcholine. Okay va? Your acetylcholinesterase. அப்ப anti-acetylcholinesterase என்ன பண்ணும்? It is going to prevent from metabolization of your acetylcholine. Thus what happens? They are going to be getting accumulated in your muscarinic and nicotinic site and therefore they are going to increase the action of your acetylcholine. அப்ப already you had read your acetylcholine oda uses, acetylcholine oda action. அப்ப அது இன்க்ரீஸ்டா இருக்க போகுது இந்த கண்டிஷன்லாம். எந்த கண்டிஷன்ல உங்களுக்கு இன்க்ரீஸ்டா வேணுமோ அப்ப இந்த ட்ரக்ஸ் கொடுக்குறோம். இதோட சைடு எஃபெக்ட்ஸ் என்னவா இருக்கும்? இன்க்ரீஸ்ட் ஆக்ஷன் ஆஃப் யுவர் acetylcholines are going to be its side effects. So then you will now itself you have a better idea what we are going to talk about. This is going to be your first essay which we are going to deal with. கரெக்டா? உங்களுக்கு எக்ஸாம்ல how they asked, I'll just tell you. I have just gone through the question papers. Question paper பார்த்தப்ப உங்களுக்கு how this question is asked அப்படின்னு நம்ம பார்த்தோம்னா one thing is classify anticholinesterase, discuss the mechanism of action and indications of reversible anticholinesterase. This is what the question. Okay, அப்ப first நமக்கு என்ன தெரியணும்? anticholinesterase ஓட mechanism of action தெரியணும். அப்புறம் what are the types அப்படின்னு நமக்கு தெரியும். So types என்னன்னா reversible, irreversible. Reversibleனா they are going to bind with the cholinesterase for a period of minutes to hours, then it is going to release from it. ஓகேவா? So அதுக்கப்புறம் வெளில போயிடும். So அது your reversible. Irreversible na enna? They're going to bind to your cholinesterase and they form a permanent covalent bond. அப்ப என்ன ஆகும்? You cannot reverse the mechanism. Okay, so அது வந்து ப்ராப்ளம் ஆகும். ஸோ அப்ப என்ன பண்ணோம்? நமக்கு இப்ப ரெண்டுமே என்னென்ன பாயிண்ட்ஸ், என்னென்ன ட்ரக்ஸ் எந்தெந்த ரிவர்சபிள்ல எது இருக்கு, irreversible எது இருக்குன்னு தெரியும். So this is your acetylcholine. You have this esteretic site, anionic site. ஓகேவா? ஸோ இப்போ வந்து நார்மலா acetylcholine உட்கார்றப்ப என்ன பண்ணும்னா உங்க cholinesterase என்ன பண்ணும்? It is going to be breaking down the choline. It is going to break down the acetate. ஓகேவா? irreversible anti-acetylcholinesterase என்ன பண்ணும்னா they are going to sit only on the esteretic site. ஓகே, ஆனியோனிக் சைட்ல எதுவுமே இருக்காது, எஸ்ட்ராட்டிக் சைட்ல தான் இட் இஸ் கோயிங் டு சிட். அப்ப உங்களோட இந்த acetylcholinesterase என்ன பண்ணும்னா இந்த acetylcholinesterase வெறும் எஸ்ட்ராட்டிக் சைட்ல இருக்கிறதுனால உங்களுக்கு ரிவர்ஸ் ஆகாது. ஸோ இட் இஸ் நாட் கோயிங் டு கெட் removed from the acetylcholine receptor, therefore it is going to be a irreversible. இது வரைக்கும் any doubt is there? If no, we will see the pharmacological action. Okay va? So pharmacology of anti-acetylcholinesterase is similar to that of your direct cholinergic stimulant, but it is going to vary in the muscarinic, ganglionic, neuromuscular and CNS action. So சின்ன சேஞ்சஸ் இருக்கும். அந்த சின்ன சேஞ்சஸ் மட்டும் தான் நீங்க ஞாபகம் வச்சுக்கணும். புக்ல வந்து பாத்தீங்கன்னா anticholinesterase எல்லாமே படிக்கணுமா அப்படின்னு கேட்டாங்க. எல்லாமே படிக்க தேவையில்லை. You have to remember just what is necessary. Okay va? Just what is necessary. So I'll give you a fine example. Hydrophonium. Okay va? Hydrophonium or your any stigmine drugs, physostigmine, neostigmine, pyridostigmine, இவங்க எல்லாரும் எப்படி ஆக்ட் பண்ணுவாங்கன்னா, they are going to be present both at the aesthetic side and anionic side. அப்ப remove பண்றப்ப ஈஸியா remove ஆகிடும். ஓகேவா? But what happens? Organophosphorus compound is going to be sit only on the aesthetic side and it is not going to sit on the anionic side. And remember one thing, இதுலயே ஒரு confusion என்னன்னா, hydrophonium. Your hydrophonium வந்து பாத்தீங்கன்னா, they are going to sit only on the anionic side, not in the aesthetic side. ஆனா anionic sideல மட்டும் உட்கார்ந்தா that is not going to cause any problem because anionic sideல இருந்து you can remove easily. Anionic sideல இருந்து you can remove easily. Okay. Is it clear? Okay. What is going to be the pharmacological action? I'll tell you. So your anticholinestrase, as I told you already, they are going to stimulate both your sympathetic and your parasympathetic ganglia. ஓகேவா? நம்ம முன்னாடி பார்த்தது வெறும் பாராசிம்பத்தட்டிக், ஆனா இங்க சிம்பத்தட்டிக் பாராசிம்பத்தட்டிக் ரெண்டுமே ஆக்ஷன் பண்ண போகுது. ஓகேவா? on the CVS, parasympathetic effects of it's going to predominate, therefore leading to the bradycardia, hypotension, negative inotropic effect, and cardiac output is going to be reduced. In higher doses, what happens? Your BP is going to increase. Why? Because of the stimulation of sympathetic ganglia. இப்ப புரியுதா உங்களுக்கு? ஹையர் டோஸ் கொடுக்கறப்ப என்ன ஆகுது? சிம்பத்தட்டிக் கேங்லியாவையும் ஸ்டிமுலேட் பண்ணுது. That is why what happens? There is a rise in the BP. The effect on the gastrointestinal tract, respiratory tract, eyes, இது எல்லாமே similar to that of your cholinomimetics. ஓகேவா? In higher doses, what happens? Since it is going to cross your blood-brain barrier, what is going to be the problem? They can cause seizures. So that is what you have to remember. Okay, seizures on the now that will be followed by coma, that will be followed by the respiratory arrest. Is it clear? Till this, any issues are there? Next is going to be your skeletal muscle. Skeletal muscle was the neuromuscular junction. Lower dose now they're going to increase the force and strength of contraction with fibrillation and fasciculation. But higher dose they cause persistent depolarization. Adinala, what happens? They are going to cause weakness and paralysis. In the box in the symbol now. I think this is not working. Okay, so higher doses persistent depolarization that is going to cause neuromuscular block, that is going to cause weakness, and that is going to cause paralysis. That is going to cause weakness and that is going to cause paralysis. Is it clear? Nice. G80 eyes same and the action say that. Now coming towards your reversible cholinestrase. Reversible cholinestrase na physostigmine, neostigmine, pyridostigmine. Okay, where physostigmine, neostigmine, pyridostigmine, rivastigmine. Then you have this three stigmine illada drugs. Enna hydrophonium, donepezil, galantamine. Okay, va? Just give me a minute. I'll just have a water. Okay, so now coming towards the physostigmine. Physostigmine is again an alkaloid that is going to be obtained from the Physostigma venenosum. So it's a tertiary amine. It has a good penetration through the tissues. The actions are similar to that of your cholinergic agent. What are the uses? Glaucoma, atropine poisoning. In atropine poisoning, you could give physostigmine. Here is actually similarity. Physostigmine, that is a, what is it? So physostigmine they are going to be anticholinestrase. So physostigmine it is atropine poisoning you will give. Similarly, when there is going to be a organophosphorus poisoning, ultava what you are going to give? Organophosphorus is also your anticholinestrase. Anga ninga atropine kudupinga. So that's important. I think I just wanted to let you know. And glaucoma envelope percentage kudupinga. This is very important. Okay. So glaucoma envelope percentage kudupinga. IV injection okay, you have to give how much? So it is also available as IV injection. Okay, eye drops are 0.1 to 1% eye drops are pilocarpine nitrate 2% availability. Okay, so physostigmine is used in the glaucoma. Okay, still I didn't tell you. IV atropine. So your physostigmine is used in two important conditions. One, atropine, okay, poisoning, or TCA, tricyclic antidepressants. Antidepressants or poisoning cases will be coming to your casualty. What all you're going to give? For that, you're going to give is 0.5 to 1 mg oral drug you're going to give, and 0.5 mg IV you're going to give. So 0.5 to 1 mg oral is going to be given, 0.5 mg IV is going to be given. Okay, next is going to be your neostigmine. Neostigmine அப்படிங்கிறது it's a synthetic quaternary ammonium compound. So it's a synthetic ammonium compound. In the ammonium compound is not going to be absorbed properly via your guts. Okay, guts la proper it is not going to be and then it is not going to have that much action in the blood brain barrier cross kuda avlo alaga pannadu. Okay, so neostigmine appa edukku neostigmine nama kudukurom, so it does not cross your blood brain barrier, it is has a poor penetration in the tissues, it is not going to be absorbed easily. Then why we are giving in the question varano ungalku, we are giving it because it enhances your skeletal muscle strength and force of contraction of muscle. Appa enga nama kudupom in the drug, we are going to give in the Myasthenia gravis. Okay, post operative paralytic ileus, you are going to give in the atony of urinary bladder. Now you have to know the comparison between a physostigmine neostigmine. Physostigmine neostigmine oda comparison purinjudha, why you are giving it அப்படிங்கிறதுக்கு நமக்கு நல்லா தெரியணும். Okay, and one more important thing is your neostigmine does not have any CNS adverse side effects. CNS side effects irukadu. Okay, next is going to be hydrophonium. I already told you hydrophonium is going to bind at the anionic side, reversibly at the anionic side on the acetylcholine esterase. It is going to prevent the hydrolysis of your acetylcholine while bound to your enzyme. They are going to be short acting, 5 to 10 minutes. What are the clinical use? They are going to be used in the, okay, it is going to be used in the diagnosis of myasthenia gravis. So myasthenia gravis we are going to give neostigmine, but diagnosis of myasthenia gravis, what you are going to give? You are going to give hydrophonium. Okay, hydrophonium kudupinga. So hydrophonium oda idu enna 10 to 20 minutes it is going to act, and you are going to give this IV intravenously in snake bite. You are going to give in the cruel poisoning. Why in cruel poisoning you are going to give? Because that is going to be causing a rapid onset. So I told you already, this is going to be a rapid onset. That is why you give. Okay, next, indirectly acting agents used to treat Alzheimer's disease. Yeah, இப்போ வந்து நம்ம அதை தவிர நம்ம என்ன சொன்னோம், டாக்ரின் அப்படின்னு ஒன்று சொன்னோம். ஸோ இதுல ரிவோஸ்டிக்மைன் அண்ட் யோர் டோனோபிசில், அதுல ஒரு இம்பார்ட்டன்ட்டா சொல்லிடுறேன். ரிவோஸ்டிக்மைன் அப்படிங்கிறது why we started is it is going to act at a longer period of time. It is used again in the treatment of Alzheimer's. Okay, it's again used in the treatment of Alzheimer's. Okay, so how you are going to give it Alzheimer's la rivastigmine? Rivastigmine வந்து பார்த்தீங்கன்னா lipophilic. They are going to be causing a cerebroselective cholinesterase inhibitor. And how you are going to start the drug? You are going to start 1.5 mg. You are going to give by dosage 1.5 mg rivastigmine BD you are going to give. Okay, so after gradually you can increase till 6 mg. Okay, you can increase till 6 mg BD. Okay, 6 mg வரைக்கும் you can increase. அப்ப என்ன இம்பார்ட்டன்ஸ் இங்கன்னா, நீங்க திருப்பி சிஎன்எஸ்ல அல்சைமர்ஸ் டிசீஸ தனி கொஸ்டினா படிப்பீங்க. பட் இங்கேயே நீங்க ஒரு ட்ரக் பார்த்திருக்கீங்க, இந்த ட்ரக் நான் வருதுன்னா அல்சைமர்ஸ் டிசீஸ் கொஸ்டின்ல ரிவாஸ்டிக்மைன் நம்ம படிச்சிருக்கோம் அப்படின்னு you can remember and you can write in the exam. Then you know this pyridostigmine. Pyridostigmine is very similar to neostigmine, but it is a longer acting. How much you are going to give? So pyridostigmine எவ்வளவு கொடுப்பீங்க அப்படின்னு நீங்க பாத்தீங்கன்னா 60 to 180 mg TDS. So available marketல இருக்க drug வந்து பாத்தீங்கன்னா myastin அப்படிங்கிற drug available இருக்கு. 60 mg dose கொடுப்போம். Okay, 60 mg dose TDS we will be giving. Clear? Is it any doubt in this? Then you have this donepezil. Donepezil is another reversible anticholinestrase. It is going to be used at the longer duration. இதுவுமே வந்து பாத்தீங்கன்னா Alzheimer's diseaseல நம்ம கொடுப்போம். So tacrine we are going to give. Okay, it is going to cause blood brain barrier. Donepezil we are going to give cognitive and behavioral importance improvement கொன்னும். Galantamine is also going to cause, okay, similar to rivastigmine. Again you are going to give in the Alzheimer's disease. எதனால galantamine important கொடுக்கறோம்னா, galantamine will be having a higher bioavailability. I hope you all know what is bioavailability. We will soon have a session for the general pharmacology. Bioavailability increase பண்ணும். What is a drug name? So உங்களுக்கு drug name marketல வந்து Galamer அப்படின்னு கிடைக்கும் drug 4 mg tablet. Okay, this will be a 4 mg tablet. இது வந்து எவ்வளவு கொடுக்கலாம் அப்படின்னு பாத்தீங்கன்னா 8 to 16 mg can give as a BD. BD னா என்ன? Twice a day you can give. Clear? Now coming to the therapeutic use. What are the uses of reversible anticholinestrase? So you can use it as a meiotic agent. Physostigmine causes spasm of your accommodation and can cause decrease in the IOP. Glaucoma வந்து physostigmine use பண்றோம் pilocarpine ஓட சேர்த்து midriatica use பண்றோம் to reverse the effect of midriatic we are going to use. So இந்த 4 பாயிண்ட் நான் வச்சது இந்த 4 பாயிண்ட் மட்டும் தான், வேற எதுவுமே நான் வச்சுக்கல எக்ஸாமுக்கு. Glaucoma, it is going to counteract your midriatic after eye test. It is going to prevent adhesions between your iris, lens or cornea. It is going to break the adhesion and it is going to form iritis, corneal ulcers. Okay, well, then you're going to use in the Myasthenia gravis. Myasthenia gravis na enna? Anyone? It is a chronic autoimmune disease. What happens? There's a progressive weakness with a rapid and easy fatigability of your skeletal muscles. So antibodies to your nicotinic receptors are going to be formed. What happens? They are going to bind with the receptors. They are going to inhibit the action of acetylcholine. So what happens? They are going to cross-link with your nicotinic receptors. They are going to cause degradation. Therefore, there will be less number of your nicotinic receptors in the neuromuscular junction. Or a neuromuscular junction la உங்களுக்கு receptors கம்மியா இருக்குன்னா what happens? There will be less neuronic action. So அதை நம்ம prevent பண்றதுக்கு நம்ம என்ன பண்றோம்? We are going to give Myasthenia gravis la we are going to give what we are going to give? Reversible anticholinestrase. Okay, so the symptoms எப்படி இருக்கும் அப்படின்னு பாத்தீங்கன்னா neuromuscular paralysis will be like your tuberculosis, eptosis, diplopia, your dysphagia, difficulty in speaking, weakness of extremities. இதெல்லாம் தான் வந்து பாத்தீங்கன்னா what you will be seeing. Okay, now coming to the what are the uses of this anticholinestrase? Where all you are going to use it? So anticholinestrase, okay, you are going to use it where? To enhance your acetylcholine action. To enhance your acetylcholine action. Just a minute, I'll just have a water. Is everything clear then? Do you have any doubts up to this? Can I continue? Can I continue? Yes. Okay, so இப்போ வந்து Myasthenia gravisல நம்ம எது கொடுக்கிறோம் அப்படின்னு நமக்கு தெரியும். Post operative why we are giving urinary retention prevent பண்றதுக்கு we are giving அதுவும் நமக்கு தெரியும். Again poisonings, என்னென்ன poisonings அப்படிங்கறது we will be seeing now. Okay, now I'll tell you anticholinestrase இருக்குல்ல அது என்ன பண்ணுனா it enhances your acetylcholine action at the NMJ, that is your neuromuscular junction, and it is going to prevent the destruction. I think I have told you all these things. I'll come for this diagnosis. இதுக்கு தான் நான் வரப்போறேன் இப்ப. I'll just let you know. ஓகேவா? அப்ப என்ன பண்ணும் அப்படின்னு பாத்தீங்கன்னா உங்க Myasthenia gravisல ஓகேவா you are going to add this neostigmine. So உங்களுக்கு இப்போ வந்து உங்களுக்கு என்ன பண்ணும் nicotinic receptorsல போய் இது ஆக்ட் பண்ணும். So thus what happens? It is going to prevent the destruction of your acetylcholine. Whenever there is a destruction of your acetylcholine is prevented, what happens? There is going to be increase in the force of contraction of your skeletal muscle. It is going to improve the muscle power. It is going to not only cause a symptomatic relief, it is also going to prevent further development of the disease. Adverse effects are due to what? Due to the concurrent muscarinic receptor stimulation. Okay, what happens is in future the patient may go for a increased salivation, meiosis, abdominal cramps. Okay, okay, இதுதான் வந்து பாத்தீங்கன்னா side effects நமக்கு வரும். Now coming to neostigmine. நார்மலா இந்த neostigmine தான் Myasthenia gravisல நம்ம கொடுப்போம்னு சொன்னோம். இந்த neostigmine எவ்வளவு கொடுப்போம் அப்படின்னு நம்ம பார்த்தோம்னா 15 mg 4 hourly we will be giving, or pyridostigmine 60 mg 6 hourly. Neostigmine na 15 mg 4 hourly. Neostigmine na 15 mg you will be giving 4 hourly. இதெல்லாம் தான் additional points. So what makes difference between average scorer and a topper is இந்த point தான். Neostigmine எவ்வளவு கொடுப்போம் 15 mg 4 hourly அப்படின்னு எக்ஸாம்ல எழுதினீங்கன்னா the person who is going to correct will be impressed. Similarly pyridostigmine எவ்வளவு கொடுப்போம் 60 mg 6 hourly we will be giving. 60 mg 6 hourly we will be giving. Okay va? Edrophonium 2 mg is used for the diagnosis. அதுதான் வந்து பாத்தீங்கன்னா okay, so that is going to be your diagnosis க்கு யூஸ் பண்றது. And இதுல வந்து you are going to have two tests. ஒன்னு provocative test, இன்னொன்னு ameliorative test. What is this provocative test? What is this ameliorative test? So, so in the ameliorative test and the provocative test, this rendu edna ameliorative test na enna hydrophonium IV you're going to give it in the IV kudukka porom. Your muscle strength, okay va, is going to be increased. The myasthenia vanda increase agi, it is going to cause other muscular dystrophies are that is not going to be the action. So I'll tell you again, I'll repeat you what I am just coming to tell. Or pyridostigma, neostigma, pyridostigma நீங்க கொடுக்கறப்ப what happens, it is going to increase the muscular strength in the myasthenia. By what happens, there is a direct stimulation of your nicotinic NM receptors. அதனால உங்களுக்கு improvement இருக்கும். Whereas in other muscular dystrophies, there won't be any improvement. And what is this provocative test? Provocative test now 0.5 mg D-tuberculin. If you are going to give, there will be increased or profound weakness in myasthenia patient. There is going to be increased or profound weakness in the myasthenia patient. So that's the provocative test. Okay, va? Treatment and I told you already, neostigmine 15 mg, 4th hourly you're going to give. Okay, va? So it's actually 4th hourly, not 6th hourly. Neostigmine for 4th hourly you're going to give, and frequency is going to be adjusted based on the response. Pyridostigmine is going to be alternative. Over treatment with anticholinestrase will cause persistent depolarization, and they are going to cause weakness again. Again, that is very critical. Atropine is given in that case. It is going to cause intolerable muscarinic adverse side effects, and you are going to have corticosteroid, which is going to be causing a production of NR receptors and increase the neurotransmitters. Okay, va? NR receptors increase panni, NR antibodies increase panno, and immunosuppressants, anti-NM antibodies. அப்ப என்ன பண்ணுவோம் நம்ம prednisolone 30 to 60 mg daily can be given. இது எதுக்குன்னா டைரக்டா உங்களுக்கு நார்மலா அங்க வரக்கூடிய ஆக்ஷன் என்ன ஆகுது, myasthenia gravis is autoimmune antibody. There is going to be autoimmune antibody towards your NM receptors. அந்த NM receptorsக்கு நம்ம வந்து இது பண்றதுக்காக immunotherapies நம்ம கொடுப்போம். Okay, therapeutic use in a post-operative paralytic ileus patient, you will be giving 0.5 to 1 mg subcutaneous. Post-operative decreasation la neostigmine, okay, you're going to give 0.5 to 2 mg. Cobra beta andna neostigmine oda sethu atropine you will be giving to prevent the respiratory paralysis. And belladonna poisoning, you are going to give a physostigmine blocking, which is going to block your CNS and cause peripheral cholinergic poisoning. And drug poisoning like your tricyclic antidepressants, as I already told you, angalamu nama kudupom. Okay va? With this, is it very clear? Okay, இங்க நம்ம ரெண்டு விஷயம் தெரியணும். ஒன்னு என்னன்னா, what is a myasthenic crisis? So like your factors like your infection, surgery, stress, all these can cause a muscle weakness. That is myasthenic gravis. Okay, myasthenic crisis. However, severe weakness can also result from an excess dose of an anticholinergic drug. அதுக்கு பேரு cholinergic crisis. அப்ப ஒரு cholinergic crisis-யும் ஒரு myasthenic crisis-யும் எப்படி differentiate பண்ணுவீங்க? Very easy. You are going to differentiate by a hydrophonium 2 mg IV. When the weakness is worsening upon application of hydrophonium 2 mg, it is a cholinergic crisis. Treat with the atropine. If the muscle is going to be improved, then it is a myasthenic crisis. You are going to treat with more anticholinestrase. So on the difference you have to know. Okay va? And the difference you have to know. அப்போ உங்களுக்கு எக்ஸாம்ல திடீர்னு myasthenia crisis, myasthenia gravis, drugs acting for myasthenia gravis அப்படின்னு கேட்டாங்கன்னா, first importantா நீங்க இந்த neostigmines-லாம் எழுதிட்டு, then you have to write about the corticosteroids, then you are going to write about immunosuppressants. So எதுக்காக ரெண்டும் கொடுக்குறோம் அப்படிங்கிறது உங்களுக்கு தெரியணும். ஓகேவா? பாய்சனிங்ல எதுக்கு கொடுக்குறோம்னு தெரியணும், க்ரூரேர் பாய்சனிங் அங்க என்ன பண்றோம்னு தெரியணும். ஸோ மற்ற எல்லாமே அல்சைமர்ஸ் டிசீஸ்ல எதுக்கு யூஸ் பண்றோம்னு தெரியணும். ஸோ ஐ திங்க் இது வரைக்கும் கிளியரா? இதுதான் வந்து anticholinestrase. ஒரு எஸ்ஏ கொஸ்டின் இப்ப நம்ம பார்த்திருக்காது. இந்த எஸ்ஏ கொஸ்டின்ஸ்க்கு இவ்வளவு எழுதுனா it is more than enough. Okay, anyone, any doubt till this? If you don't have any doubt till this, we will move towards the second essay question, that is organophosphorus poisoning or insecticide poisoning. Can you just anyone put in the chat box if it is clear or not? Shall I continue or not? Okay, thank you, Dinesh. So I'll just move on towards the irreversible acetylcholinesterase. Remember, organophosphorus compounds are very powerful inhibitors of your acetylcholinesterase enzyme. They are going to bind with the enzyme as a stable compound. They are going to bind in the extrinsic site, and the enzyme is going to be phosphorylated. They are going to be irreversible. Therefore, what happens? They are going to get acetylcholine is going to get accumulated. Excessive accumulation of acetylcholine is going to cause excessive cholinergic action. Excessive cholinergic action is going to cause என்னென்ன அதுதான் நம்ம பார்க்க போறோம். Clear? Now, in the OP வந்து பாத்தீங்கன்னா யூஸ்னா ஒன்னே ஒண்ணுதான். என்னன்னா glaucoma. Ecothiophate eye drops can be used sometime in the glaucoma patients. ஓகேவா? அது யூஸ் பண்ணுவாங்க ecothiophate அப்படிங்கிற ட்ரக். பட் மத்தபடி ஓகே மத்தபடி organophosphorus poisoningனால poisoning அதாவது toxicity தான் நிறைய. So OP poisoning is one of the most common poisoning, especially in India, where the farmers are more in population, where it is used as an insecticide. Because of that, there are more poisoning. OP poisoning is more in the country like India. Therefore, we are reading it with the utmost concentration. So previously, when I was studying actually, forensic medicine வந்து பாத்தீங்கன்னா pharmacology ஓட சேர்ந்து தான் நாங்க எழுதுவோம். Forensic medicine again, OP poisoning is very important question. Repeated கேக்குற question வந்து OP poisoning. அதனால ரெண்டுத்துக்குமே யூஸ் ஆச்சு நாங்க படிக்கிறப்ப. But now you are in the third year. Therefore, இப்ப நீங்க clear-ஆ படிச்சீங்கன்னா third yearly it is going to be useful. ஓகேவா? So இப்ப என்னென்ன example of OP poisoning? Okay, organophosphorus compounds. என்னென்ன? ஒன்னு வந்து what are the organophosphorus compounds? Ecothiophate, malathion, parathion. ரெண்டு தான் நமக்கு ஞாபகம் இருக்கும். வெரி ஃபேக்ட்ஃபுல். இந்த ரெண்டு தான் நமக்கு ஞாபகம் இருக்கும். மீதி எல்லா நேம்ஸும் இருக்கு. சுமித்தியான், டைஃப்ளாஸ், டயசீனியான், இது எதுவுமே ஞாபகம் இருக்கா நமக்கு எக்ஸாம்ல ஞாபகம் இருக்கா? ரெண்டு தான், மேலாத்தியான், பாரத்தியான், இது ரெண்டு தான் ஞாபகம் இருக்கும். இதை தவிர டாக்ஸிக் நர்வ் கேஸ் இருக்கு, சாரின். இது வந்து யூஸ்வலா வந்து இட் இஸ் வெரி இம்பார்ட்டன்ட் பிகாஸ் சாரின் நர்வ் கேசஸ் ஆர் யூஸ்டு ஸ்டில் by the government, by the police officials. It is going to it is going to be still used in many parts of the country, but not in India as such. But in several news, if you're going to see, sarin toxic nerve gases are still used to especially in places where still armed army rule is going to be there. அங்கெல்லாம் வந்து காமனா யூஸ் பண்றாங்க still. ஓகேவா? கார்பமேட் வந்து பாத்தீங்கன்னா you have this carbaryl, propoxure, aldicarb, இதெல்லாம் வந்து பாத்தீங்கன்னா they are going to be a carbamate insecticide. ஓகேவா? now இப்ப நமக்கு தேவை வந்து பாத்தீங்கன்னா how this anticholinestrase is going to act. So anticholinestrase என்ன பண்ணுது? estric siteல bind ஆகி it is going to block. Okay, so what are the signs and symptoms? As I already told you, if you are listened carefully, the uses of acetylcholine, இப்ப இது ஈஸியா இருக்கும் உங்களுக்கு. So what happens? Muscarinic effects, they are going to cause profuse sweating, salivation, lacrimation, increased bronchial secretion, bronchospasm, increased vomiting, meiosis அதெல்லாம். Nicotinic effect, again twitching, fasciculation, muscle weakness. Central effects என்ன ஆகுது? Confusion, convulsion, coma, death. இதை நான் எப்படி ஞாபகம் வச்சுக்கிறது? Already you know that anticholinesterase எல்லாமே they are going to cross your blood brain barrier. அப்ப central nervous system effects இருக்கும். This one thing, if you want, you can take it a photo of a screenshot, because இது எல்லாமே உங்களுக்கு symptoms ஒரே photoல it is going to give you. I'll give you 5 seconds, just take a screenshot if you want, or else I will share this slide itself at the end of the session. Diagnosis: OP poisoning can be diagnosed by history of exposure, characteristic signs and symptoms, and estimation of cholinesterase activity in your blood. So treatment வந்து பாத்தீங்கன்னா remove the contaminated cloth first. Gastric lavage should be continued till you are going to get a fluid. Clear? எப்படி gastric lavage பண்ணுவீங்க? Anyone? What is the tube used? Anyone? Can you just give in the chat box what is the tube used to gastric lavage? இது ரொம்ப இம்பார்ட்டன்ட். ஒரு கேஷுவாலிட்டியில if you're going to be posted, you should know this. Most of us, we will be like begging for chance for this tube insertion. Riles tube. Okay, remember we will be giving a Riles tube. Riles tube தான் நம்ம என்ன பண்ணுவோம்னா gastric lavage பண்ணுவோம். இது வந்து தெரியணும். Dinesh, very good. And then airway should be maintained and artificial respiration should be given. Always ABC அதை நம்ம வந்து ஸ்டிட் பண்ணிடணும். அப்புறம் diazepam எப்ப கொடுப்பீங்க? Because you know that they are going to cause central nervous system action too. Therefore, to control the convulsion, we will be giving diazepam slow IV. இப்ப நான் கொடுத்திருக்க ஸ்லைடு அப்படியே எக்ஸாம்ல எழுதுங்க. இதை தவிர வேற எதுவுமே எழுதணும்னு அவசியம் இல்லை. ஓகேவா? ஃபர்ஸ்ட் அட்ரோபின், அதுதான் ட்ரக் ஆஃப் சாய்ஸ். இன்ஜெக்ட் 2 mg IV ஸ்டாட். You are going to repeat every 5 to 10 minutes. You can double the dose if necessary until your patient is fully atropinized. எப்படி நீங்க atropinized சொல்வீங்க? Very easy. The patient, the thing must be like fully dilated pupil will be there. Tachycardia will be there. So atropine should be continued for 7 to 10 days. So what is the atropine you are going to give? அகைன் அட்ரோபின்ஸ் நமக்கு ஆல்ரெடி தெரியும். நம்ம எப்படி இருந்தாலும் நெக்ஸ்ட் படிக்க போறது அட்ரோபின் பத்தி தான். ஓகேவா? நெக்ஸ்ட் நம்ம அட்ரோபின் பத்தி தான் நம்ம படிக்க போறோம். ஆன்டிகாலினர்ஜிக் ட்ரக்ஸ்ல அட்ரோபின் என்ன பண்ணணும்னா, they are going to block your muscarinic receptors. ஓகேவா? ஸோ மஸ்குரானிக் ரிசெப்டர்ஸை பிளாக் பண்ணும். ஓகேவா? அப்ப என்ன ஆகும்னா, இந்த மஸ்குரானிக் சிம்டம்ஸ் எல்லாமே ரிவர்ஸ் ஆக ஆரம்பிக்கும். ஓகே, வாட் ஆர் த ட்ரக்ஸ்? ஆக்சைம்ஸ். இப்போதைக்கு நான் வச்சுக்க வேண்டியது ஆக்சைம்ஸ் அப்படின்னு நான் வச்சுக்கோங்க. அட்ரோபின் இஸ் நாட் எஃபெக்டிவ் டு ரிவர்ஸ் த நியூரோமஸ்குலர் பேரலைசிஸ். ஆல்வேஸ் ரிமெம்பர், அட்ரோபின் இஸ் நாட் like they cannot reverse your neuromuscular paralysis. Therefore what happens is we are going to give oximes. What is oximes? Example is pralidoxime. So remember pralidoxime, PRALI, pralidoxime. So what does this pralidoxime do? This pralidoxime, they are going to bind with your cholinestrase organophosphate complex. They are going to release the cholinestrase. So thus what happens? This cholinestrase are going to degrade your acetylcholine and all the thing is going to be reversed back. So neuromuscular transmission can be improved by giving cholinestrase reactivators like your oxime drugs. What are the oxime drugs? Pralidoxime, obidoxime, pralidoxime, obidoxime. So these are the கிளியரா? ஆன்டிகாலினர்ஜிக் ட்ரக்ஸ் வந்து பாத்தீங்கன்னா, so you have this ஓகேவா? so இதோட முடிஞ்சது. இதுக்கப்புறம் நெக்ஸ்ட் வாட் ஹேப்பன்ஸ் இஸ், okay, so they should be given within minutes after the poisoning, preferably immediately, because your complex undergoes aging and enzyme cannot be released. The complex becomes more stable by loss of chemical group and thus responsible for aging. Cholinesterase reactivators are not useful in poisoning where that is going to be caused due to a carbamate compounds. So anyone, can you give me the example of carbamate compound? Carbamate compound enna? Your carbaryl, 7, your propoxure, your aldicarb. இதுக்கெல்லாம் இது ஒருவேளை if you have taken, if the patient has taken, you can, இது வந்து பாத்தீங்கன்னா those compounds are not going to have a free site, anionic site for binding of oximes. Therefore, okay, so pralidoxime has a no role in that. In severe poisoning, what you are going to do is you are going to give 1 to 2 gram of IV pralidoxime within 5 minutes. You are going to give within 5 minutes you have to give, okay, before aging takes place of poisoning. This is going to give a best result. But in practice வந்து பாத்தீங்கன்னா patient 5 நிமிஷத்துக்குள்ள வர மாட்டாங்க. அதனால okay, it will take 6 hours after poisoning தான் நம்ம கிட்ட வருவாங்க. Okay, and what is this diacetyl monoxime? Diacetyl monoxime is a lipid soluble. Therefore it crosses your blood brain barrier. Blood brain barrier cross பண்ணி அங்கேயும் உங்களுக்கு CNS-லயும் cholinesterase regenerate பண்ணிடுது. Cholinesterase regenerate பண்ணுது. So that is the reason why you give that. And what is chronic organophosphate poisoning? So some OP compounds can produce neurotoxicity several days after exposure to the compound. This toxicity came into light when thousands of people got paralyzed in America after consuming a drink called as Jamaica ginger. இந்த ஜமைக்கா ஜிஞ்சர்ல என்ன இருந்ததுன்னா ட்ரை ஆர்த்தோக்ரிசைல் பாஸ்பேட் TOCP இருந்தது. இதனால வீக்னஸ் வர ஆரம்பிச்சது, பிளாசிட் பேரலைசிஸ் இருந்தது. ஸோ அப்ப வந்து பாத்தீங்கன்னா அப்ப வந்து உங்களுக்கு இந்த ஆல் திஸ் காம்பவுண்ட் எஸ்பெஷலி யோர் pralidoximes அது கொடுத்து தே ரிவர்ஸ் பேக். So அதுதான் வந்து chronic OP poisoning. So with this actually we have completed the entire cholinergic drugs. Okay va? So I'll give two options. Either I'll give you a 5 minutes இதுலயே break நம்ம எடுத்துப்போம். இந்த 5 minutes அப்புறம் we will start again with the anticholinergic drugs, or second option is I can start tomorrow night at same time நம்ம cholinergic drugs பார்க்கலாம். Okay, either I can do two things. Okay va? Either you can continue now, or what happen, you can select whether you can continue tomorrow. What do you want me to do? Whether I can continue today, okay, whether I can just continue, or I can just tomorrow we can do. Your option only. I'll give you for 2 minutes. Just select whatever you think is correct. If you're going to give me like this, one person is telling continue, other person is telling tomorrow, what I can select some more out of 10 people. Others also, please give your opinion so that whether I can continue or I can continue it tomorrow. More 5 people. Are you awake? Thank you. Remaining 4. Okay, so as you all told me, you asked me to just skip tomorrow. We can continue tomorrow, right? So till this, I think many understood what is the exact thing. I'll share your PPT with you all. So even anticholinergic drug, I'll share you the complete PPT so that tomorrow you just read about it. So this will be helping you like complete the whole topic. Okay, any doubts, DM in the group, or you can just share me, you can just message me in the PC also, I can help you. So I just let me know in the chat box that whether this is useful to you to understand. This 1 hour, I think you could have completed 2 essay questions. One organophosphorus poisoning, இன்னொன்னு anticholinestrase. The ரெண்டுமே essay கேட்டிருக்காங்க examல 2 question you have covered completely. Still 1 question is left. That is going to be atropine. Along with atropine, along with adrenergic, I'll do. So, sir, where did you share PPT? I'll share it in the group itself. I think you are there in the group. If you are not there, I'll just 1 minute. I'll just put the link of the group also here. If you are not there, you can just join in the group now itself. Okay. So the group name is either if you are there in the support group also, I will share in that. Otherwise, I will share in the Medusane 2K21 group. Okay, either of this I will be sharing either in 2K21 or in the support group. I'll give the both the links here. You just join whichever whichever group you want, you can join. Okay, I think I have. I'll just share it now. Yeah, is everyone able to see the group link? So this group link is actually I started for additional batch separately. If you want to join second year batch group also, I'll just share you the link of second year batch group. In that also you can just join. Okay, the second one is the second year batch group. This one is going to be your supply batch group. So both the things you can join if you want. So I'll also put it in the YouTube, the same session, whatever I have taken today, I'll just put in the YouTube also so that for further references, you can actually see it. So with this, I think I can stop for today. Tomorrow, most probably at 9:30 at the same time, we will see the anticholinergic drugs. Okay. Thank you so much. Thank you for joining. Also, you can just put your comments. I will open up the group for comments till 11:30. You can just put your how this class was there to your other people who are there in the group so that encourages your friends to join in future. And also do send these links to your juniors also so that even your juniors can start joining and they can also listen, because this is not just for supply. This is going to be helpful for everyone. So they can also join. Okay. Thank you so much.